Joining us once again on the programme, Dr. David Nabarro, the World Health Organization's Special Envoy for the global COVID-19 response. Dr. Nabarro, always good to see you. And it has been a little while since we last chatted, which usually means that things have been going relatively well with COVID. 2 years on from the first domestic lockdown here in the UK. Globally, what's the picture like?
Well, we still are in the middle of a quite unpleasant pandemic. Other things have dominated the news recently, but my quick summary is the virus is continuing to move. There are still an awful lot of people getting sick and dying each week, and we cannot be complacent. I'd like to ask everyone, do continue, if you can, to wear face masks in crowded places. Do continue to maintain physical distancing. And if you are vulnerable, and that means if you've got other diseases, do please shield yourselves. And the most important way to do that is get vaccinated. We're living with the virus and it's still causing a lot of problems.
Dr. Nabarro, I don't know the last time that you might have spent any amount of time in London or anywhere else in England. Right now, it doesn't feel like anyone or very few people are adhering to those recommendations. And they remain recommendations for the government to keep our distance, to wear masks in crowded places. People aren't doing it.
Yeah, I've noticed that. Actually, I mean, I'm more of the time in France and Switzerland, and I have to say, certainly in France, people are being remarkably careful. I'm told by my children that it's a different situation in the UK. My only advice to everybody is just don't forget, remember that this has killed so many people and that it's still nasty. I don't want to get COVID, and I don't think anybody else should. You know, we're also learning about long COVID, which is when you get infected and you think you're going to get better, and then you've got several weeks of being unwell, under the weather, unable to do what you want to do. Here it is. People are the solution to this pandemic. Let's do what we can to not let it get ahead of us again.
I mean, I was speaking to someone kind of involved in the public health response here in the UK, a couple of days ago. What does it look like? What does living with COVID-19 actually look like? And they said, look, it's going to be lots and lots of people catching it, some of those people getting ill, but crucially, very few people actually losing their lives. I mean, is that what living with COVID looks like for you?
I hope so, but to reach that point and to stay there, we have to all be up to date on our vaccinations. After you've been vaccinated, the defenses in your body gradually fade. And for some people, older people like me, the fading is a bit quick. So I have to say to everybody, keep your vaccinations up to date. You should certainly have got 3, and perhaps you should be thinking about a 4th if you're in the older community. And so with that up-to-date vaccination, with being careful on not exposing ourselves, we'll live with COVID, but from time to time we'll have a few scares.
Dr. Nabarro, I want to ask you about something that I saw in the papers the other day. Another vaccine that is being developed at the moment, the world's first plant-based vaccine that we're told. The report suggested that the WHO would reject that vaccine because the company developing it is half owned by the tobacco giant Philip Morris. I mean, what is the truth of all of that?
So I cannot answer that question.
Okay.
There are complexities there, but I do want to say to everybody, new vaccines are going to go on being developed from lots of different sources, and we need to be ready for real strides forward in the whole area of vaccinology, including through the technology you've described.
Just in terms of testing, do you still feel that mass testing has a role in the Western world right now?
Well, as I've said, the virus is the problem. People are the solution. You can't solve the problem and live with COVID if you don't know where the virus is. And so if there's one thing I'd like to ask all governments to try to maintain, that is easy access to testing. We always say that if the proportion of people who test positive in a country rises above about 10%, then there's not enough testing being done. There are many countries in Europe where there should be more testing done. In that way, we know what's going on. In that way, we keep ahead of the virus.
Dr. David Nabarro, always good to see you. I hope you and yours are well. Thanks for joining us.